the press members and sincere thanks. So in the specific patient, there is something called aortic stenosis. Severity will come more than 8 years, but otherwise killer bleed regular monitoring valve thrombus metallic valve will not grow. Advised by Ross is the aorta, this is pulmonary artery. And the aorta is the blood pulmonary artery on the right side of the lungs. In the wall, the aortic valve. That's why we have valve. Mitral valve is the left side. Tricuspid valve is the right side. So the Ross procedure is in the pulmonary valve, the patients are normal. That's why pulmonary position is homograft. The donor valve. The pulmonary valve the patient own valve plus natural valve, it will grow as well as the child is growing. 16-17 years when they grow, it grows. So majority of the patients, it will last even 20 years, 30 years, 40 years. One of the celebrities who had is Arnold Schwarzenegger. Because we know how Arnold was, how active he was, and how fit he was, and that is very important for him. He cannot take blood thinners. So he had a Ross procedure, and it is done well. In the patient, particular patient, he was very young. The procedure, it was more than 25 years ago. Cherian sir and Madhushankar sir did the Ross procedure. So they replaced the aortic valve with the pulmonary and put a pulmonary valve homograft, which lasted 26 years. I doubt even mechanical valve would have supported that much. Any bioprosthetic valve put 10 years of failure. Now what has happened is both of them failed. This aortic autograft, it significantly failed and it was leaking significantly. Pulmonary valve narrowed and leaking. That's because the outflow valve, blood heart outflow valve, inflow valve, mitral valve, tricuspid, severely started leaking. So moderate to severe mitral regurgitation, severe tricuspid regurgitation. Right side pressure normal 30 but in the patient 90 blood pressure 100, right side pressure 90 to 100. Distended peripheral edema. So literally he was struggling. There was no possibility of sleeping, no breathing possibility. It gradually got worse. For 1 year it got worse to the stage he was not able to stay at home. He was in the hospital most of the time. So he visited all the major hospitals in the city, and all of them said redo surgery is not possible, because as soon as we go on the pump to replace the valve, he will not come out of the pump with a pulmonary pressure of 100, replacing aortic valve pulmonary. Aortic valve, this is a calcium whatever valve available, Gina valve that is not available in India. It's available only in US, Europe. So we have to use the best available valve, that is the Edwards valve, in that position. We needed a lot of assessment, a lot of imaging. Dr. Ashik is here, we have got a fantastic imaging specialist. One of the problems is, if we keep, this is the actual valve, Edwards valve, calcium it can go to the LV or go to the aorta, migrate item. So we needed a support team. Dr. Madhushankar was also in theatre, so we had 2 surgeons on standby, perfusion team, whole team. This is not a procedure you can do in any hospital. You bypass patient, immediately we have to do surgery. So thank you, Arun. And he cancelled all his surgeries. Normally Arun Kumar sir does 2 or 3 surgeries. He cancelled all his surgeries. He stayed in the cath lab throughout until the procedure is done. And he left the cath lab. Thank you. So normally sir will be opposite when you get into trouble. Then all the problems will come about the payment, about the issues, all the other things. From that aspect, Dr. Mahesh, Dr. Ayappan and Dr. Arvind, they all said, whatever it is, we'll support, we'll take care. One day, that is the reason we were able to get that outcome.
Aortic valve disease aortic valve, metal valve, tissue valve, pulmonary valve. Pulmonary position la or homograft வைக்கணும். So முதல் கஷ்டமே நம்ம homograft இருக்கணும். அதான் முக்கியமான காரணம். முன்னால homograft கிடைக்காம இருந்தது. இப்போ heart transplant கூடின பிறகு homograft கொஞ்சம் ஃப்ரீயா கிடைக்குது. ஏன்னா அந்த இறந்தவங்க டொனேட் பண்ணவங்க இந்த இறந்து புதுசாக வைக்கக்கூடிய ஹார்ட்டு பழைய ஹார்ட்டு இதில் கிடைக்கக்கூடிய aortic valve pulmonary valve எடுத்துகிட்டு about 250 RAS procedures. And this is one of the most successful series. ஏன்னா youngest patient வந்து 3 months old and we wanted a RAS procedure. So we had a very good success rate, and now after 20 years majority of them are coming back because of the failure of either of the valves. In fact, sir didn't know there was a patient before this who what we have done is Dr. Raghuram did the aortic valve alone because at the time pulmonary valve was nalla irundhu, and recently we did the pulmonary valve percutaneous valve. So one surgery replacement, another one percutaneous valve. Anyhow, RAS is no more, but RAS procedure is one of the fantastic innovative procedures for aortic valve disease. Thanks for